Care plan documentation basics. A care plan is like the roadmap for providing support at home. It tells you what the older person needs, how they like things done, and who will do what. Getting the care plan right and keeping it up to date is one of the basics of good home care. Under the new Act's person centered approach, care plans aren't just paperwork. They're a collaborative tool created with the older person's input to ensure their rights and preferences are respected. So, what should a good care plan look like? First, it should clearly outline the services and supports the person will receive. This includes details like the types of services, for example, personal care, cleaning, nursing visits, how often they will occur, and if there are any specific instructions or preferences. For example, the care plan might say assist Mrs. Lee with showering 3 times a week, mon/wed/fry, in the morning using the pink floral soap she prefers. Ensure water temperature is warm, not hot, per her comfort. This level of detail shows respect for the person's routine and preferences. Care plans should also note any goals the person has, maybe improving mobility, staying socially connected, or maintaining a clean home. By writing down goals, even simple ones like wants to walk to the mailbox independently, everyone on the care team knows what the person is working towards and can encourage them. A critical part of care plan documentation is capturing the person's decisions and consent. For instance, if an older person chooses not to have a particular service or has opted out of a certain activity, note that in the plan. The plan might also cover safety measures or risks. Say the person is at risk of falls. The plan should mention any fall prevention strategies, remove loose rugs, use a shower chair, etc. If any assistive devices or medications are part of care, these should be listed too. Essentially, anyone reading the care plan, with permission of course, should get a good picture of how to support that individual day to day. Another fundamental is keeping the care plan updated. Needs change. So the care plan is not a static document you write once and forget. If Mrs. Lee's health changes or she decides she'd rather shower in the evenings, the care plan should be adjusted. In fact, the new best practice guidance emphasises updating the care plan to reflect any agreed changes in the person's decisions or preferences and adjusting routines accordingly. Keeping documentation of these changes supports continuity of care and shows that you're responsive to what the person wants. Regular reviews, often every 6 to 12 months or after a big change or hospital visit, are a good habit. During a review, you sit down with the person and their family if they want and talk through what's working, what's not, and update the plan together. Clarity and simplicity are also part of the basics. The care plan should be written in plain language. We'll talk more about that in the next segment, so that the older person and their family can understand it easily. Avoid jargon or overly clinical terms when simple words will do. And don't bury important information in long paragraphs. Use bullet points or headings for sections like services, preferences, safety notes, etc. to make it user friendly. Remember, the care plan is often shared with the person and possibly multiple support workers. It needs to be clear to everyone. Finally, treat the care plan as a living document that belongs to the person. Encourage them to keep a copy and to speak up if something on it doesn't feel right or needs updating. For example, if the plan says a worker will arrive at 9 a.m., but the person would prefer 10 a.m., that's something to discuss and change in the plan. By getting the care plan basics right, clear content, person centered details, and regular updates, you ensure that daily care aligns with the older person's needs and choices. It's the foundation of delivering consistent quality support at home. To deepen your understanding of care planning under the new Act, including examples and templates, visit the Aged Care Learning Hub for more info.